I would like to introduce my guest, Dr. Tanya Doherty, a specialist scientist at the Medical Research Council in Cape Town, South Africa. Welcome, Dr. Doherty. Could you please tell us what being a specialist scientist entails?
Thank you for inviting me. My work involves doing research on HIV, particularly on HIV in women and children, and looking at national government policy and how it works to alleviate the virus amongst our population in South Africa.
Okay, and I'm going to ask you a few questions about the current U.S. government funding of AIDS. And so, what do you think the main problem with the current U.S. government funding of AIDS is?
Well, the funding is particularly focused at consumables like drugs, and it predominantly goes to US-based organizations in South Africa. So the vast majority of the funding is actually going towards US-based citizens who work in organizations in South Africa. And so less of the funding is actually reaching the ground in terms of patients and South African workers, health workers, who are combating the virus.
Do you think that the U.S. government is providing sufficient amounts of money to the AIDS cause?
Yes, I think the amounts of funding are really high, and in fact we often struggle to spend the money. There's not sufficient absorptive capacity in South Africa to spend the money, so often there is actually a surplus of funding that's being provided.
Though Tanya does mention that the government is providing surplus funds towards her organization, the U.S. government should not decrease their amount of funding internationally because not all organizations are receiving the same amount of funds as Tanya's.
54% of all money in the world that is spent on AIDS in the developing world is coming from the U.S. It's thanks to the President's emergency plan for AIDS relief that he announced in the State of the Union about 2 years ago. And that really, for me, was a historic step where we moved, as I called it. I called for many years, I said we've got to move from the M word to the B word, from millions of dollars to billions of dollars.
I think it's the weak health systems and shortage of healthcare workers, managers, and facilities that is causing the low rate of actively treated people.
I think that, yes, providing the drugs is one part of the process, but actually having sufficient human resources, infrastructure, and transport and laboratory capacity is really what enables people to access treatment. And so the funding is not really being focused at those other systems issues, which means that fewer people access treatment than it should be.
It's $844 million over 2008 funding, which totaled $23.3 billion. This is for HIV and AIDS funding. We'll get into some of the specifics later, but is that dollar figure high enough in your
not at all. And that figure is focusing on care and treatment, prevention, and research.
Should billions of dollars continue to be earmarked for AIDS only, or should the funds be allotted more broadly to strengthening health systems, improving living conditions for women, and general development? What do you think?
I agree that it's short-sighted to only fund one disease specifically. Really, we need funding that's going to target more of the basic living issues, access to water, electricity, sanitation, which, as we know, plays a huge role in people's health and well-being. And so we really need much more funding to be focused on these basic infrastructure.
The U.S. is doing about $4 billion annually on global AIDS. Are other countries participating in this effort to that extent?
Yes, sir. Actually, the European Union is stepping up to the plate, the government of Japan. There's some work going on. The countries themselves, Russia, China, some African governments are starting to increase the level of their own investment into this response. But the U.S. has a special opportunity and responsibility because we are the richest government in the history of the planet, and we have the opportunity to show our compassion and show what America really is about by investing in this critical crisis.
A recent World Bank study found that 88% of drugs purchased for South Africa either did not reach the patient or were inappropriately administered. What do you think?
I think there is a risk that by just focusing on the provision of drugs, you're not ensuring that the people who need them are going to get them. there needs to be more focus on the systems to ensure that people do get the drugs, which means looking at human resources, enough doctors and nurses to provide the drugs, transport mechanisms to get the drugs out into the rural areas, and laboratory capacity for conducting the tests that are necessary for people who are on drugs. So we need to look beyond simply the provision of the drugs and look at the other systems that are needed.
I feel a community-based approach is very important in actively making sure that patients are receiving their antiretroviral drugs. One suggestion that I would make is having a healthcare worker have a certain group of patients and making sure that they check and administer the drugs daily in order to decrease the mortality rate.
The reason we respond to it is because of the incredible devastation globally. And again, our international resources are very small compared to our domestic resources and for far more people. So the American people are taking care of ourselves here at home for HIV/AIDS. But if you look at the total resources for heart disease and cancer dwarf many times over the resources for HIV.
What do you feel is the number one thing that the U.S. government can do in order to help increase those who are being actively treated?
I think one of the important things is not to focus on just sort of drugs and HIV alone, and to look at some of the broader health systems issues, right from the ground level in terms of human resources and infrastructure, clinics, laboratory infrastructure, but also in terms of health management capacity, because our government needs support to manage the funds that have been given to it appropriately and to be able to carry out the policies that are needed to ensure that people get treatment. So we need some support at our national government level to be able to carry out the treatment plans appropriately.
Testing and counseling, so knowing whether you're infected or not with HIV is extremely important for at least two reasons. One, to know whether you're infected or not, and so to organize your life. If you're negative, then this is an additional incentive to stay negative. If you're infected, you can seek help, support, seek treatment. So it's really important to do it. And it's very important that in developing countries where most people in Africa have no clue that they're infected, and we know that 28 million Africans are living with HIV, but most of them have never been tested because it's too expensive, there are no services and so on, and because of the stigma around it. And so that's why these new tests that are very rapid tests, where in 10 minutes you can find out whether you're HIV positive or not, are so important in the new campaigns to offer treatment to people and to intensify the counseling and anti-AIDS education campaigns. So that's an example of a technological breakthrough that will be very important.
In closing, thank you so much for taking the time to discuss this important topic and sharing your professional opinion with me.
My pleasure.